Hi guys, it's Dr. Bader with Muir Orthopaedics. Just wanted to touch base with you guys, say hello, and wish you well. I know obviously we're in difficult times right now, and we just wanted to post some videos to give you guys some helpful advice to help you navigate some of the issues you're dealing with. This video is going to be on helping you rehab and maintain your strength and flexibility in your shoulder while you're managing either a condition or waiting to have surgery. So a couple of things I just wanted to show you is a little bit of stretching and some strengthening, and maybe finish off with a couple of pearls of just strategies to manage your pain. So first one I wanted to show you was just a stretch. So if you just have a countertop that's close by about this height, it makes it really easy to just stretch the shoulder. So first stretch is similar to what the therapist had probably showed you in the past, which is a table slide. So you just put your hand on the countertop, make sure it's something sturdy and doesn't slip away, and all you do is just plant your hand on the table and just walk away. And as you're just walking away, you just want to kind of lean your body down and stretch it out. Now, depending on how flexible your shoulder is, it's going to allow you to go a different distance. But if you can only go this far, that's fine. Just kind of push it to its limit. But the more you can go as far as your shoulder will allow you, and then hold it for about a minute. And then you can rest it and then do it again. And try to do a few cycles for a couple of minutes, a couple times a day, so you can really kind of get that flexibility to continue. The next one is from the side. You just kind of find the wall and you slide up the wall and then just lean into it. The nice things about these exercises, it requires your body weight. So you're just kind of leaning into it instead of having to navigate or manipulate any complex equipment. You're just using your body weight to kind of stretch the shoulder. And again, do it for about a minute. You can do it while you're watching TV or talking to someone. And the other one, just find a pillowcase or a towel. This is very convenient. You don't need to have bands or weights. You just drop it behind and then grab it and then use the other arm to pull the arm up. This is kind of an internal rotation stretch right here to pull your arm behind your back, especially if you're trying to get to your bra strap. This is a good practical exercise for women who want to be able to get that flexibility back. So you use your left arm. You see up top, I'm pulling my arm up, and you just want to do that and hold it for a minute or so. You can even have someone do it for you slowly, as long as you're still holding on to it. And so that's the stretching. And then when it comes to some strengthening, just to kind of maintain some tone in your shoulder, one is called an isometric wall push, where you just put your arm against the wall and you just push and just hold that spot. And you want to feel the contraction in your shoulder. So here I'm just kind of pushing against the wall, and I want to hold it for a few seconds, and then I'll relax. Then I'll push it against the wall, and I'll relax. You can do it a couple different ways. You can push with the fist, and that's really focusing on the rotator cuff, or you can push with the elbow, and that's focusing on the deltoid. So there's different ways to do that. And you want to do 3 sets of about 5 seconds, and then rest, and then do that about 3 times. Then the other one, again, you don't need bands or weights. Just grab the towel or the pillowcase and you can use your other arm as the resistance. And you do as much as feels comfortable, but you feel like you're doing a little bit of work, and you just go in this position here about 45 degrees out, not all the way in front, not all the way out, about 45 degrees. And you just grab your arm and you just lift, and that's a good rotator cuff strengthening. You just give your body as much resistance as you like. You can give yourself more and really kind of fight, or less, and then just kind of just go through the motions. And try to do 3 sets of 15. And then I would do 1 of each of these exercises and then cycle back through 3 times, and you can finish them all in 3 sets. So don't forget about strategies. Try to avoid things that really aggravate your shoulder. Icing is always helpful. And then good old ibuprofen, which is either Advil, Motrin, or ibuprofen. You can take 600 to 800 milligrams. Preferably with a light meal. If you have any stomach upset, you can try using it with some antacid or some acid-reducing medications. But if you can't take it, then use Tylenol or even consider alternative strategies. So hopefully these help, and we'll see you guys soon. Bye-bye.